Also, if you're getting a lot of acne, if you're noticing a lot of facial hair on your face, in the jawline area, usually you're feeling more fatigued, even painful periods, which are so typically talked about as like, oh, well, that's just normal, or my mom had that and my sister had it, so this is just what we kind of have to deal with. That is actually not necessarily true and could have to do with a hormonal imbalance that can be fixed when we look at other things going on in your life. Low sex drive as well can impact, be an influence from hormonal imbalance, and something that I find women are a lot of times scared to talk about. They feel like they're very alone, and that is something that could absolutely have to do with their hormones being out of whack.
Welcome to Salad with a Side of Fries. I'm your host, Jenn Trepeck, talking wellness and weight loss for real life. We're here to clear up the myths, misinformation, bad science, and marketing to teach you how to eat and how to cheat. Are you ready? I'm having salad with a side of fries. Hi, friends. Welcome back to Salad with a Side of Fries. I'm super excited for this episode because I think you're going to hear from another expert the reinforcement of so much that we talk about all the time and in a slightly different context. So I'm thrilled to introduce you to our special guest. She is a women's health nurse practitioner practicing at public clinics and private practices since graduating from the University of Pennsylvania in 2014. She's passionate about educating and empowering women about their bodies, which spurred her to create The Ladies Guide, an educational channel across media platforms to discuss common women's health topics, from knowing your birth control options to how to empower yourself during your GYN appointment. In one-on-one sessions, she helps women rebalance their hormones and improve their fertility without the use of medications, using lifestyle changes instead, which we love, right? To top it off, she's a certified yoga teacher, enjoys spending time with her husband and dog on hikes, traveling the world. And in all of her work, she takes a holistic approach, blending Eastern and Western modalities to form a unique treatment plan for each woman, making sure women feel seen and heard is her number one priority. And now that woman is you. So friends, help me welcome Deanna Tikhonov.
Hello. Thank you so much for having me, Jen.
Yeah, thanks for joining us. I just want to jump right in, tell everybody, like, you're a nurse practitioner, but I mean, first of all, what does that mean? How is that different than other nurses that we know? And was this always your plan? Like, did you know that this is what you wanted to do?
Yeah, that's a great question. And I love educating people about it because I know there's a lot of confusion. So, a nurse practitioner is somebody who has gone to school for nursing first, has an undergraduate degree in nursing, and then goes on to get their master's as a nurse practitioner. And you can choose a specialty, whether it's adult, pediatric, psychiatry, women's health, which is what I did. And you go through the program, a little bit different depending on if you go full-time, part-time, but at the end you have a master's degree in that specialty, and then you take a certification test allowing you to practice seeing your own patients, being able to diagnose, treat, and manage a patient without necessarily needing to have a doctor to ask. Whereas as a registered nurse in RN, which I was before, you do still need to ask doctors for orders. You can't prescribe medication independently on your own. So that is a very simplified version of the difference of a nurse practitioner and a nurse.
Perfect.
And I kind of did always know I wanted to do this. When I was in nursing school, I didn't know what a nurse practitioner was until a lot of my professors I was learning were nurse practitioners. And I just thought they had a great lifestyle balance. Being a RN first, I did the 12-hour shifts. I worked holidays, weekends, working nights, and that can sometimes take a toll depending on where you are at in life. And I kind of always knew that I wanted to have more of a standard Monday through Friday, knowing I had my weekends off, things like that. And I craved that independence to be able to, if I knew the information, to be able to manage my patients without having to always go to a doctor to make sure something was okay. So I kind of knew early on in undergrad that I was going to go for my master's. I decided to work a little bit in the hospital for a few years just to gain experience, which I think was great, just to get that confidence and see all different things. It was a really eye-opening experience. And then I went back for grad school.
Amazing. And so before we get too deep, I know I want to tackle a whole bunch of topics today, but before we do have some male listeners. And so I want to say to them, like, don't stop listening yet, right? What would you say to them as far as why they want to keep listening and maybe how to listen?
Yeah. So, we're going to talk about a lot of different things. I know regarding women's health and hormones. And the message I want to get across to men, whether you are in a relationship with a woman, maybe have just sisters, moms in your life, understanding that they're not crazy when you think they're crazy. There's a lot of science behind why they may be experiencing certain things. Also, if you are a man with a daughter, just the importance, as you'll see through this episode, of living a healthy life and how that impacts your children and their development and things that girls will go through as they hit puberty and things like that. So that is also really important. And I'll also say that, if they're thinking of starting a family with their partner, understanding that their health is just as important as a woman's. Sometimes it's all focused on the woman preparing for pregnancy, but making sure that a man is living a healthy lifestyle can definitely improve the chances of fertility and starting a family.
Awesome. All right, guys. So hang
Mhm.
with us. Don't go away. I know in your conversations with your patients and in our conversations, talk a lot about underlying causes of our symptoms, like getting to the root cause of the issue versus treating symptoms. But then it's often the symptoms that we identify. And so, in the context of today, much of the underlying issues are likely to be hormonal imbalance, like you just mentioned. But how does it manifest in all these different ways? So, what are the many things someone might notice that, based on hearing our conversation today, they could say, oh, I think the underlying issue might be hormonal imbalance? But, like, how does that show up?
Yeah, that's a great question. And I hear it constantly. Even yesterday in the office, I had few patients in a row. I'm like, and we were just talking about all the hormonal imbalances. So things that usually women will start noticing is particularly with their periods, if they start becoming irregular, maybe more spaced out, maybe more frequently, maybe becoming heavier, maybe becoming almost non-existent, a change in their cycle. That is a sign that their body is communicating with them that something else is brewing under the scenes. And when you don't have a healthy menstrual cycle, there's probably something else that's going on linked in the body that is not working out the way it's supposed to. So those are a few things off the bat that if you see any menstrual cycle changes, also if you're getting a lot of acne, if you're noticing a lot of facial hair on your face, in the jawline area, usually you're feeling more fatigued, even painful periods, which are so typically talked about as like, oh, well, that's just normal, or my mom had that and my sister had it, so this is just what we kind of have to deal with. That is actually not necessarily true and could have to do with a hormonal imbalance that can be fixed when we look at other things going on in your life. Low sex drive as well can impact, be an influence from hormonal imbalance, and something that I find women are a lot of times scared to talk about. They feel like they're very alone, and that is something that could absolutely have to do with their hormones being out of whack.
Amazing. First of all, I think you also just blew people's mind that, the pain around that time of the month could actually be optional, or
Exactly.
mitigated through different ways. So amazing. And as you were sharing too, things that were occurring to me and stuff that I hear from people is also mood challenges or, erratic moods. Everything in our body is controlled by hormones, dramatic changes in appetite, all sorts of things
Yes,
are
absolutely.
driven.
Yeah, and the mood changes is a big one. Just feeling like they're kind of all over the place throughout the month. Many times they'll report they have anxiety or feeling depressed, but not on medication or not comfortable to go on medication. And it could actually be that they don't need to go on any kind of anti-anxiety medication. They just need to look at different lifestyle things. And a lot of times too, it's very closely linked to how they're eating, with sugar spikes and going up and down. Everything is so connected. I always tell women that I talk with, it's never just one thing. It's always layered, and we kind of have to unbury and get to the bottom of what's going on.
Yeah, so let's jump in there. What are some of the options? I mean, you mentioned sugar, which is certainly something I talk about all the time. I know, birth control, hormone replacement therapy, exercise. I mean, you tell us, right? What are some of the options for treatment that someone might want to consider?
Yeah, so the options would be really starting first looking at your diet. And I know there's a lot of so much information, and that's a lot of what you talk about out there, of all these different things that can kind of contradict each other sometimes. And I try to keep it very simple. I respect that everybody is going to have their own dietary preferences, but in general, and I don't think most people dispute this, you want to really eat whole foods. Not from the store brand, but just whole foods that grow from the ground, whole grains as well, and trying to just avoid anything that's processed, that comes in a box, that's frozen, that can sit on a shelf for a long time, is probably not good for our bodies. It has a lot of refined carbs in there, which converts to sugar in the body. And I know you know all about this, and talk to your audience. So it seems so simple, but it's everything, because that's a way to start getting the nutrients that our body actually needs, which then allows all the organs and all the processes that go on in the body to work the way they're supposed to, so that nothing in your body is overworking, which then can cause it to just stop working, which then down the line, those are why the symptoms that I just mentioned start coming up. But really, it's been going on for usually a long process before it gets to this point, where you notice symptoms. So always starting at the base of just starting to look at what you're eating, that you're trying to make the majority of your the foods on your plate vegetables, whole grains. The protein should actually be a bit smaller, and whether that's an animal protein or a plant-based protein, that's completely, a person's preference. I don't have much of an issue with that, as much as I just have of just everybody usually needs to increase their vegetable intake. What your mom told you as a kid of eating more vegetables, which I hated, FYI, as a child, and that's all I eat now, is something that it's still true. And every study shows that, whether you're plant-based or not necessarily. I think that's something everyone can agree on.
Yeah, for sure. And we'll jump into some of the other options, but I love what you said, choose whole natural foods from the earth. That's what we talk about all the time. Like, we have a couple episodes on reading labels. Like, you don't need that if you eat foods that don't have a label.
Exactly. And I'll also say that if you can afford organic food, it is a good idea to try to start incorporating it little by little. It doesn't have to be that everything is organic, but there's definitely benefits to that as well, reducing the amount of toxins that you're also taking in, which also plays a role affecting our hormones. So it is good to try to start incorporating that if you can, but I don't want that to be something that intimidates people or kind of steers them away altogether, that it's something you kind of incorporate little by little, making it sustainable to be in your life. Other things as well is with the food, when you're eating healthier whole foods, not only are you giving the right nutrients to your body, but you're also helping to heal your gut, which a lot of times, if your gut health is off, which most of us also experience that, especially with the overuse of antibiotics. If the gut health is off, your hormones in the body are not processed the way that they're supposed to, a lot of times leading to an accumulation of hormones rather than letting them leave your system the way they're supposed to keep everything balanced. If you're not going to the bathroom every day, I know people don't like to talk about this, but it's something that really, really could impact your hormones with time. So if you're eating, again, whole foods, you have a lot of fiber in your diet, your gut health will be better. You're able to have a regular digestive tract system going on. Also, this food will help you with liver detoxification. And with this liver detoxification, it also helps to break down the hormones, because basically hormones are in the body in different forms, and certain forms need to be excreted from the body. They're not meant to stay in the body. When they stay in the body, they get stored in your fat, which then can lead to a lot of different things that we just talked about, sometimes causing what's called estrogen dominance, where there's too much estrogen in the body, usually leading to many of the symptoms that I mentioned: heavy periods, painful periods, acne, things like that. So it's so much with food that, as you see, affects so many different body systems. And then the other thing I would also mention to tackle is decreasing stress, how we handle stress, I would say, because the stress is never going to fully go away. That's the reality. But I think that the society we live in, it's so much of, we're in fight or flight response almost always, whether we realize that or not. We're in the car, somebody cuts us off, that sets us off, or maybe we turn on the news first thing in the morning, and it creates this cycle where actually cortisol, which is our stress hormone, which is one of the top hormones that kind of trickles down everything else. So if this is constantly being fired off, it affects everything. So learning how to manage stress in a healthier way, not grabbing the wine every time. Sometimes it's all about balance.
Because I know, right? Yeah.
All about balance for sure. But if you find that you're maybe having more unhealthy habits, like maybe grabbing a cigarette or drinking, not the best thing to do over time. So learning how to reduce our stress levels that are happening through good stress reducing techniques is really the way to go. And that's something could be as simple as a 5-minute breathing exercise. By doing that, you actually turn on your parasympathetic nervous system, which is our rest and digest nervous system, that helps create the exact opposite effect of what I just mentioned of the fight or flight response. So when we do that, scientifically, research has shown how things start reversing in the body, and then your body is able to start working again the way it's supposed to. When we live in a constant fight or flight response, our blood supply actually diverts to areas that are considered not essential. And one of them is actually the reproductive system, because nobody wants to be having a baby. Your body is not going to want to create a baby if you are in chronic stress all the time. So it makes sense from an evolutionary standpoint, although, we're not running away from a tiger anymore. So, and it's not beneficial anymore if we're constantly in that state. So from simply breathing, meditation, yoga, gentle exercises can be very helpful to help learn how to manage your stress better. So it's really looking so much as a holistic approach, looking at all different aspects of a woman's life. And it could be a little different for everyone, depending on really what's their main thing that we need to kind of address.
Yeah. You guys, we're all going to have to listen to this 5 times because it's everything you just shared is so spot on with everything that we talk about all the time. And it's just great to hear it again from another voice to reinforce, the impact of stress and how every hormone, it's a cascade. And I often describe it as, when one hormone is up, its counterpart hormone is down. Like they both can't be high. And so if we're always in this alert, right, the parasympathetic nervous system that allows us to relax never has a chance to turn on. So thank you for all of this. I love it. And like I said, it's really everything we talk about here all the time. And I just want to say to everybody one more time, we are here to help you live your healthful lifestyle and make it easier to do that. One of the ways that we do that, certainly with each episode of the podcast and also with our membership program. For just $10 a month, you get weekly recipes, a monthly article or tool, extra discounts from me and our partners and guests, plus access to live Q&A sessions with me. So this is seriously a bargain at $10 a month. So this week, our members are getting 2 recipes. One for cauliflower Spanish rice, because often with the recipes I send you, I suggest ways to complete the meal. And cauliflower rice is a great one that I often suggest. And the other recipe is for easy shrimp stir fry so that we can change up our protein options, change up the food we're making, and maybe this is a little takeout inspired as well, as we're all eating at home more than usual these days. Plus, this quarter, instead of a group Q&A sessions, you're getting a complimentary one-on-one chat with me. So I mentioned this last week. The booking options are still available. I know some of you haven't booked your time yet, so you'll see that again this week as well. So I really can't wait to hop on the phone with you. Remember, you must be a member to receive these goodies to your inbox. So to become a member, go to glow.fm/salad with a side of fries. Glow is glow.fm/salad with a side of fries. $10 a month. It's really a no-brainer and basically free when you take advantage of the full offerings provided. So click the link in the show notes or go to the URL. Once you're there, you click support now, enter your email, payment method, click subscribe, and that's it. You're in. Remember, this week you're getting 2 recipes, the cauliflower Spanish rice and the easy shrimp stir fry, plus your one-on-one session where we get to talk about you. So show yourself that your health is a priority with this membership. All right. Back to our conversation with Deanna. Let's talk about a few of the hot topics in your field. So the first one is birth control. And many times I think the only option we think of is the pill. But I know there's hormonal, non-hormonal, even the pill is different than it used to be. So give us the lay of the land. What do we need to know?
Yeah, absolutely. And I find too in practice that many women are familiar with the pill or just kind of like, well, I don't know of anything else. And I just think it's so important that whether you're pro birth control or not, just knowing your options and making the best choice for you. It's not for everybody. It depends on the time you're at in your life and what your pregnancy goals are. So, just diving right in. So the pill is something we all know about. It's something you have to take daily around the same time. It does have a lot less hormone than it did 30, 40 years ago, which kind of is what gave it a really bad rep at that time because there were significantly more hormones in the pill, which led to a lot of more unnecessary side effects. Weight gain was probably the biggest one that was always reported. Now that is not really the case. And I would also say that if you're kind of following a healthy lifestyle, everything that I just talked about, that the chances of having any unwanted symptoms is less likely really with any of these birth control methods. So that is like at the forefront of if you're living healthy, it's much less likely. It's what I see in practice is that a lot of times if you're not living healthy, maybe not eating the right foods, it kind of the birth control method you choose can exacerbate what was already kind of going on. So that's why you might see sometimes that some women are like, oh my gosh, this was terrible for me. And I completely believe that. And others are like, it was the best thing ever. I'm so happy with it. But besides the pill, there is also a patch that is changed each week, or there is a ring that you insert vaginally for a month and you change it every month. Generally, the pill, patch, and ring are all very similar. That's why I like to group them together because they all have 2 hormones within the method. And really the main difference is the pill's daily, the patch is weekly, the ring is monthly. So a nice way to kind of decide if this is something for you is if you really think about your lifestyle and what's important to you. If the idea of taking a pill every day sounds like, how am I going to remember to do this? This is so annoying to have to remember. Then it's okay, not the right one. The patch is something that's less frequent. Some people don't really like, there's different places of the body that it could be put on that could be discreet. Some women just still don't really like that idea. And then the ring is definitely a love or hate relationship because you have to feel comfortable with inserting something vaginally. Some people are not. And then they hear that, especially I find if you're not a tampon user, this might be something that you hear and you're like, no, not for me. And that's fine. So the next group of birth control is progestin-only birth control methods. So that means they only have one hormone inside. And for different reasons, sometimes there's medical conditions going on. If you're a smoker and you're over 35, that the first group of birth control methods might not be the best for you. Again, just a disclaimer, this is not meant to replace seeing a healthcare provider. This is all for education.
Absolutely, yes.
Yes. So make sure you definitely talk with your healthcare provider because each of you guys might have, very unique situations. So this is kind of just an overview. But the Progestin-Only methods includes a pill, so taken at the same time every day. This is typically also prescribed a lot in women who are breastfeeding because the traditional pill can interfere with breastfeeding milk supply sometimes. So the Progestin-Only method is something that is used, I see often. Then there is an injection that's given every 3 months. It's called the Depo Shot. Another one that has a love or hate relationship because
I love it. I think it's the greatest thing on the planet. But
yeah.
anyway, go ahead.
Yeah, and exactly that's what I hear. Like when women find it and they feel like it works well for them, then they're really happy with it. Other women feel that it makes their hormones go crazy, that their moods are very off, that they don't enjoy not having a period, which is a major side effect with this method. And for women who deal with very heavy, painful periods, this could be helpful. In addition, though, to the lifestyle recommendations, it's always best to really do it in conjunction. The other options would be the Iuds that get insert inside the uterus. These are done in the office. Then there is also an implant that goes in the arm. It's like in the upper arm. It's about the size of a matchstick, very small, and that's also done in the office. Those two, the Iuds and the implant, are considered long-acting reversible contraceptives. They're kind of at the top tier of most effective because there's really no room for a user to make an error in that method. There's no way they can really forget to take it once it's there. I call it a set it and forget it method. It's effective for actually 3, 5, or 10 years, depending on which one you pick. You do not have to keep them in for that entire time, but definitely if you're someone who knows that over the next few years, you don't want to get pregnant, maybe you're in school focusing on your career, and the idea of having to really be super involved, whether it's going into the office every few months for an injection or taking something every day, these are great options and they're definitely gaining more popularity. And, again, it's not for everybody. You definitely have to feel comfortable. The IUD insertion, I definitely caution of Googling insertion experiences because people tend to put the worst experiences out there. Definitely having an open communication with your provider and asking the questions, make sure they're experienced doing this insertion. And most women love it and really are happy that they chose it if it feels right for them. I really stress that you never want to feel pressured with any method. If you have a provider that's kind of pushing something at you and you're like, oh, I don't know, just say you need some more time to think about it, because typically too, I find that when you feel pressured and you do it, you might end up not continuing with that method because it really wasn't connecting with you to begin with. So the last group of birth control is non-hormonal. So the first one is another IUD that's made of copper. And for women who are really opposed to using any hormones for either personal reasons or maybe they have a medical condition where it's really not recommended, then this is something that's an option. It's also 99% effective, just like the long, I don't know if I mentioned that before, but the long acting are 99% effective. And so is this Paragard, it's called a non-hormonal IUD. And it's actually effective for up to 10 years. So, which is a nice feature for, again, depending on where you are. And so this is something that is also an option. Some women, this also tends to be a love or hate relationship. Some women may experience heavier bleeding with more cramping. It has to do with the way the IUD has copper inside, sometimes causing more of an inflammatory response in some women versus others. So it's definitely something, again, you have to talk with your provider about. If you have a history of heavy bleeding and cramping already, I really don't recommend this option because it could actually just make things worse. Any history of fibroids as well, probably not the best option to add something that might exacerbate your symptoms. Then we have the fertility awareness method, which is something that is totally on the woman to do. And really, if you're interested in really tuning in with your body, it's an awesome option, but it does require dedication to really make this work as best as possible. So what does this involve? Number one, it involves that you're getting regular periods monthly. If you are someone who is skipping around, not getting a period consistently every month, this is going to be very difficult to do. So I wouldn't recommend it in that case. But if you're somebody who has a period monthly, you want to really be tracking your cycles. There's many free apps now out there that offer you to track them and make it very easy. Once you're tracking your cycles, it's also good to start checking your temperature. First thing in the morning, before you've even gotten out of bed, you check your temperature every single day. You really need to do this for several months, at least 2 to 3 months, to start noticing a trend in your temperature. Your temperature will actually rise about 0.5 to 1 degree Fahrenheit around ovulation. So when you're tracking this over a few months' time, you will start getting an idea of when in the month you're ovulating. It's actually like 2 to 3 days before your temp goes up. That's the time of ovulation. And then the third thing that can be helpful to really put all this together and tie it together is checking the cervical mucus throughout the month, because that actually will change while you're ovulating. So as you see, it does involve a lot of different steps that you have to be dedicated to do. And I also think that it depends on where you are in life of if a pregnancy was to happen, how would that make you feel? Because at the end of the day, our bodies are not machines where it's always going to be the exact same way every single month. Different stressors or travel. If you get sick with even a cold, this could throw off your whole ovulation cycle. And then this method might not be as effective because you might think you're not ovulating during a time that you actually are. So this method can be helpful to either try to get pregnant or try to prevent pregnancy, depending on how you're looking at it. But again, it's something that if you're ready to really learn more about your body and see all these changes, which are pretty fascinating of what goes on behind the scenes, it's a great option. But again, requires a lot of work. Some people look at it that way, so it might not be the best.
Right. And so what I'm hearing from you is really choosing the method based on your level of commitment and where this falls in the hierarchy of priorities in your life.
Exactly.
So I do have a couple follow-up questions, which might be silly questions, but we've all asked them. So, or thought about them. So I'm going to ask them. With the one that goes in your arm, how it doesn't move, how likely is it to get lost in your arm?
So if it's inserted correctly by a provider, you have to be trained to do the insertion. It is not going to get lost in the arm. That's something that has happened in very rare circumstances. They actually had to change some of the instructional guidelines because they found that where it was originally being told to insert, there was a little bit more of a likelihood that it could move out of the arm and to another area. But now where it's put, it's really superficial, just right underneath the skin layer. So as long as it's being inserted correctly and not going in deeper, which is contraindicated, that's not the correct way, then it is highly unlikely for that to occur.
Okay, cool. And then is there a difference in efficacy for those that are 2 hormones versus those that are 1 hormone?
Really good question. So with the only one that has a slightly decreased efficacy is in the Progestin-Only method. So the 1 hormone would be the pill. It's called the Progestin-Only pill or the mini pill. It tends to have a little less forgiveness that if you take it over 3 hours late, so for example, if 5 p.m. is your time and you take it at 8 or 9 one night, there is a possibility that ovulation could occur and there is a chance of pregnancy. Whereas a traditional pill tends to be more forgiving. And if you're off by several hours, you should be fine, although it is really best to try to take it at the same time. The mini pill is the one that kind of clears your body much faster. That's what it has to do with, that it's broken down in the body faster. And so if you're not taking it or at the 24 hours later or more than 3 hours late, that is where you run the risk. And that's why it's usually not the one we start off with when we're prescribing a pill, if that's what a woman wants.
Yeah, and I appreciate you sharing that because that was going to be another question. Is I remember being a kid when everybody was starting to take birth control and some people had an alarm on their phone that would go off at their time and they always kept it in their handbag. And then other people would just leave it at home and take it, either each morning when they wake up or before they go to bed. And I remember having conversations of, well, the same time each day is really just about remembering to take it. Or then I remember hearing a story of somebody saying, it wasn't somebody I know, but it was like, I don't know, the story travels, right? Where someone didn't take their pill exactly on time and ended up getting pregnant, even though they were on the pill. So it's one of those, thank you for addressing this, is really the bottom line.
Yes.
And I guess I remember the last time I was at my doctor and the poster on the wall had all the different options. It was interesting to me that the shot had the same efficacy as the pill, which was less than the IUD or the implant. And so I'm sort of curious why that is, because it does remove the human element and the human error possibility compared to pills.
Right. You're talking about with the injection that it removes.
Yes,
Yeah.
thank you.
Well, because it is still something that does require a woman to have to usually go into the office unless they're able to self-inject themselves with certain, depending on where you are, sometimes that is an option and if you're comfortable. But because it still involves coming in every 3 months, there are sometimes I've had patients that, life happens, things come up, and they go beyond the 15 weeks of when they're supposed to come in. So that's the reason that although you're right, it's a lot less risk for user error, it is still technically there because it involves somebody physically usually have to go in or physically have to give themselves the injection.
Got it. Okay. And then along with birth control, there's fertility. So many of our listeners are not yet in that place in their life. Others are past it, but a majority are in childbearing years, some struggling to get pregnant. And one of the things, I mean, you and I have talked about this, is that it's actually way more common than we realize for people to struggle to get pregnant. That like, I feel like when we're kids, we're taught that it's so easy to get pregnant. And then, as you said, it's really only a couple days of the month that we're actually ovulating and able to get pregnant. So what do you recommend for people who are thinking about getting pregnant?
Yeah. So first things first, and I know I sound like a broken record, but eating healthy is really important. So kind of looking at your diet and things that you're eating and ways that you could, again, eating more whole foods, trying to eat organic when you can. That is really important. And I always just tell my patients, you want to try to be as healthy as possible before you get pregnant. It's a lot harder to fix things when you are pregnant because then you're dealing with a whole other issue of symptoms, nausea, morning sickness, and you're not going to be thinking of all these things that you need to do if you're feeling exhausted in your first trimester. So trying to start that process beforehand, starting to exercise. And if you're somebody who's never exercised, start with 30 minutes. 1 to 3 times a week and work your way up to maybe the goal being about 5. That would be ideal. Doesn't have to be this intimidating thing. Exercise is super helpful, not only to help your overall health, but while you're pregnant, the outcomes of pregnancy are better when you already have a good exercise routine. And we don't usually recommend starting any crazy exercise routines once you're pregnant. But if you've already been doing that and your body's used to it, then it's very beneficial to continue doing that. Also, stress levels. You want to make sure that you're having healthy ways to manage that stress. Again, that all ties back into affecting your fertility. If your cortisol is constantly flooding your body, it's going to be harder for you to get pregnant a lot of times. And that I find is the biggest, probably the biggest issue of why I think a lot of women are having trouble. We're living different lives. We're very focused on our career. Stress is so normalized and it's just become so common that we think it's normal when it's really not at all. And so, then you wonder, why am I having trouble with fertility? You might spend all this money. It's very costly to go through IVF procedures. And while sometimes that might be medically necessary, a lot of times just stepping back and looking at the stress in your life and really being honest with yourself of maybe ways that you can start slowing down can really be helpful. Also, just being up to date with any preventative care that you've seen your primary, that you've had like the routine blood work, looking at your cholesterol levels, screening for diabetes, getting dental care, really important. Sometimes people don't really see the link, but actually, if you get a cavity in pregnancy, it could become a lot more severe and actually travel into the bloodstream. So it's really important to get all that stuff out of the way before you actually are getting pregnant so that it optimizes really everything.
Yeah, it's interesting you bring up the dentist because when we work with dentists, a lot of times, first of all, when something is off, it often manifests in the mouth first. So our doctors are sometimes like the first line of defense, which I think is fascinating. But speaking of little ones and mothers to be, let's take a quick break for a message from our partner for this episode, DNA Miracles, because every child is a miracle. DNA Miracles provides the highest quality body and wellness products designed for babies, children, and expectant mothers. All products are gentle, easy to use, and 100% effective when used as directed. DNA Miracles partnered with leading health professionals and scientists who follow the highest standards in ingredient selection to create the most effective skin, hair, and health solutions. As natural as possible, DNA Miracles is the best and safest option on the market for you and your little miracle. From expert pediatricians to real family testimonials, everyone has fallen in love with DNA Miracles. And I'm obsessed with it too. So last week, I told you guys about the natural soothing ointment for like tough, dry skin, like your feet. Today, I have to tell you about the natural foaming wash and shampoo. So I was always on the hunt for a wash that was safe and pH balanced, and now I use this. So I recommend it to everybody. Give it a shot, see what you think. I've enjoyed it. And as they say, you work hard and DNA Miracles is here to lend a hand. Our products are the highest quality of body and wellness solutions, specially formulated for your little miracle. To get 10% off your order, text the word miracles, MIRACLES, to 844-947-4846. You'll receive the link and coupon code right to your phone. Again, simply text the word miracles to 844-947-4846. This is a toll-free number. Standard text and data rates may apply. All right. So I want to keep going with a few other hot topics in your industry. Before we do that, though, one of the things that has been coming up for me in terms of as you're answering each question, I know you work both in private practices and in public clinics. So from the practitioner side, what's the difference in treating these different patient populations?
So, I really try, that's a really nice question to ask. I really try to keep it as equal as possible, right? Whether somebody is coming into me from a clinic standpoint or private practice, it's really important to me to give them both that equal quality of care. But there are definitely challenges because a lot of times in a clinic, we do see patients that do not have insurance and they're self-pay patients, and they might not have the same resources financially to go get the ultrasound that they need or blood test right off the bat. Whereas typically in an office setting, they only take people that have insurance, or typically you might be able to afford that out-of-pocket fee if you have to. So it does involve a little bit more critical thinking skills, I would say, of really looking at, do we really need to do this test right now? And I will say an issue that is prevalent is over testing too. And that's the other piece of when we have all the resources at hand in private practice, I think there is definitely an element sometimes of over testing, over ordering, imaging that might not be necessary right away, but it's available, so you're like, okay, I'll do it. Or so that's something that sometimes has its challenges, and we have to get creative and find the resources for our self-pay patients. Oh, but there are offices definitely willing to work and try to keep it at an affordable price, even offering sometimes payment plans, really trying our best not to deny that care to a patient. But yeah, that's typically how I have to kind of manage.
Yeah. I could go off on a tangent. Our healthcare system is one of my soapbox issues, but not a topic for another day.
Yes.
So one of the other things in this space is HPV, so human papillomavirus. And between the vaccine, an abnormal pap result, you've said before that we may hear information and our mind leaps to like cervical cancer, but debunk this for us.
Yes. So, HPV with all the commercials and the vaccine, it's definitely more in our faces, I think, now. But I still think there's a lot of misunderstanding about what it is because it acts exactly what you just said. You hear HPV and you go to cancer and your mind just shuts off, especially if you're a woman who may have been told at some point that HPV showed up on a pap smear. So the thing is that HPV, that the lifetime risk of getting HPV is about 80%. So that means most people, and that includes both men and women, although the focus is really on women because the test is really only available for women. So, it makes it very likely that a woman may come in contact with this virus at some point. The thing is, though, is that 90% of women have been found to actually clear this infection without any intervention within 2 years' time. The problem becomes when HPV persists for a long period of time, years and years and years of persistence. It starts changing the cells on the cervix. And with time, a long time, it can create cervical cancer. Now, I always explain it's a very slow growing cervical cancer. Unlike other cancers, there's a lot of little steps along the way that abnormalities start to present itself. And that's why a pap smear does become very important, because when the pap smear is done as recommended, we're able to detect these small changes and kind of nip it or follow you and just repeat it in a year, or potentially do a procedure. It really depends specifically on what your results are or what your medical conditions are. If you have any autoimmune conditions, this does make you a little bit more at risk. But generally, it's something that we can manage very early on, and it almost never gets to the stage of cervical cancer. The women that tend to have more of a likelihood of getting cervical cancer, smoking cigarettes or vaping now is definitely linked to more likely to progress to cervical cancer if you already have been told you have HPV. So even more of a reason with all the other reasons to really not, because I see this in practice and it's definitely something that plays a big role. Also, if you have a poor immune system, like I said, any autoimmune conditions, this is going to suppress your immune system, and any virus is trying to take over your immune system. So if you're already kind of at a disadvantage, this can increase your likelihood. And also, if you just have not been in care for years and years, sometimes I have women that after they have their last baby, they don't come in the office for like 10 plus years because they just felt like, well, I didn't really need to. And this could be risky because this is where we could miss those little tiny changes. And then by the time a PAP is done, it's already progressed to the point of cervical cancer. So it's actually a very small group, if you are getting your PAPs as recommended, that actually it turns into cervical cancer. So it's just important to kind of, I have to talk women off the ledge sometimes when they hear for the first time that they have HPV, that this does not mean it is a death sentence at all. And actually, you have a lot more control over it, because if you're trying to live healthy, I recommend taking a multivitamin every day, taking, just good care of yourself, then you're strengthening your immune system, and then the virus will become suppressed. It's pretty simple if you look at it that way and not really get in your head about, oh my God, what does this mean?
Thank you for that. But then it sparks in me another question in terms of, an annual PAP. So in recent years, I know the guidelines have changed and say, you don't necessarily need a pap smear every single year. So given what you just shared about HPV as a patient, should we then insist on it every year? Or do we go with the guidelines, which I thought were 3 years, but I think now are 5 years? So what do we do?
Yeah, so I think first it's really important that you just have an open communication with your provider and ask exactly what's being done. So many times I have women that they'll come to me from another office and they'll say, yeah, I had a pap done. And it turns out they did it because they equate the pelvic exam with a pap smear. And those are actually two separate things. A pap smear is a specific test. The pelvic exam is the actual exam piece of it. So first things first is just asking your provider, what are they doing today and what are the tests that are being done, so that you have an understanding and really make sure you're on the same page and feel comfortable. The guidelines, yes, have changed in 2012, actually, but it's taken a long time for the medical community to all be on board. And there's still definitely points of contention. And there's definitely providers out there who will still do a pap smear every single year, no matter what. As far as I know right now, insurance is still covering it. So it's something that if you feel strongly or provider feels strongly about, I don't see it as an issue at this point in time. That might change. With that being said, The guidelines now are that women from 21 to 29 need a PAP every 3 years. Then starting at 30 to 65, it's generally that you can either still continue getting a pap smear every 3 years, which when I say pap smear, that's looking at the cells on the cervix. That's what that piece is doing. But the other part that they've added is that if you are getting what's called co-testing, where you're not just getting the pap, but you're actually getting the HPV test, then you can get it every 5 years from ages 30 to 65 if the pap smear and the co-test, the HPV piece, is negative. If both things are negative, they have determined that then you are less likely to have any abnormalities, and that every 5 year time frame would be fine. I would say from just experience and working with many different providers, I don't think many are actually fully comfortable with the 5 year, and most are doing every 3 years with the co-test. They've actually decided, okay, we'll do the co-test where we're looking at the cells in the cervix and screening for HPV, but we feel more comfortable doing it every 3 years. And I just want to preface that this is only for people that have normal results. If you have abnormal results, these screenings are completely different, and it's a different follow-up plan depending on your specific results.
Got it. And so this really brings up choosing your doctor and having that open communication. So, I mean, what do we say to them if we feel like we can't have these conversations? How do we choose a new doctor? What do you suggest we say?
Yeah, this is a toughie. I think it's hard sometimes to just determine if somebody's good for you just from like online reviews or even sometimes word of mouth, because your friend or whoever you know might have different priorities and values of what's important to them. And maybe they had a great experience because they didn't really have any concerns, but you might go to that same person somebody raved about and be like, oh, this is not the right fit for me. So I do think it's a little bit of trial and error of you do need to meet the provider. I think there are certain buzzwords that if they do have a website or you can read some reviews, if you see things like wellness or functional medicine, integrative medicine, holistic, looking for the underlying cause, any of those phrases or words are usually a good sign that they are a little bit more open to really hearing from you and looking at things as a whole picture rather than just treating a problem. But I would say that if you feel scared to ask them questions, if you feel rushed, if it makes you feel nervous to just share that, hey, like I want to talk about, like, do I need a PAP every year? Or I don't really feel comfortable going every 3, and you feel like you've been dismissed, then it's probably not the right provider for you. And that's okay. Don't feel that that's just the end of it and you just kind of have to deal with it. I know it's a hard process. Personally, I've been there, that it could be hard to find somebody that you really feel comfortable with and feels us hearing you and hearing your values, but they're absolutely out there. There's some amazing providers out there. And whether that's a doctor or a nurse practitioner, a lot of times too, I would say looking for a nurse practitioner might be another great option, because we have the nursing background. We already have a foundation of a bit more of a holistic approach, but not all providers are treated equal. There's amazing doctors, amazing nurse practitioners, and not so amazing providers out there. So not to knock one profession over the other, but just kind of look at it individually, that each person's going to have their kind of unique spin on things.
Yeah, I appreciate that so much. And one more thing I just want to throw in there is, if you go to a doctor and you get a diagnosis and their response is there's nothing you can do, it's a giant red flag. Reach out. Let's have this conversation so that your health is the priority. You are not stuck whenever you get a diagnosis. Just throwing that out there.
Yes. Thank you so much for that, Jen.
Yeah. So finally, I can't have you here and not address coronavirus. So as a health professional, what has COVID-19 taught you and taught all of us?
Yeah. So, I think it's been a time for a lot of reflection. And for me personally, it has just reinforced the idea of how much a healthy lifestyle impacts everything we do. And it's forced us to really slow down and look at areas of our life that we are likely, a lot of us neglect ourselves and are not giving ourselves the right care that we need, whether that's physically or mentally, as I've talked about. So, just realizing that that's everything, because if we start slipping, particularly if we're younger, we might not really see those effects right now. But statistically speaking, coronavirus has been shown that overall, the majority of people that were required to be hospitalized and that unfortunately passed away had other comorbidities or other medical conditions that were going on. The biggest ones being obesity, diabetes, heart conditions, respiratory infections. And all of those things are very closely linked to your lifestyle and how you're eating, if you're exercising, your stress level, all of that. And so if we can look at that and realize, okay, wait, I don't want to be in that category. Coronavirus is now, there might be things in the future that come up. And this could be a huge lesson to think, maybe going to that fast food restaurant all the time or sitting watching TV all day and not just taking that 20, 30 minutes to move my body, what that could really do over the long term. And, it could be a beautiful lesson if we're willing to see it that way, that although this has been a really stressful, crazy time, it's definitely thrown everybody's lives upside down. There is such beauty in the fact that it's shown us, it's given this other lens to see things, what's important in life and how important our bodies are and how we treat them on a day-to-day basis to help strengthen our immune systems, which will then decrease our chances of getting this virus in such a severe way, which will only help us. So it's something that it's been a lot to take in, both personally and professionally, and having to adjust to things. But I think there's so much lesson and value if we can view it and not be stressed and scared of what's to come, because that's just not going to do anybody any good.
All I can say to that is amen. Thank you. Before we move to some off-topic questions, is there anything else you want to address or share with us?
No, I think you had such great questions. I really hope that all your listeners out there gain something from this today and this conversation, and just continuing to educate yourself and just be mindful of where you're getting that information from, and not just listening to every Facebook post or Google that you do, because that's where we kind of go down a slippery slope.
Absolutely. Thank you for saying that. So every expert who joins us gets these same questions, just sort of off-topic fun things. Are you ready?
Yeah.
All right. What's the best thing you've done for your health this week? And what's the naughtiest thing you've done related to your health this week?
Well, the best thing has been I've stuck with my yoga practice. I would say I try to commit, my goal is 5 times a week. And I did that this week. So I felt really good about that.
Nice.
The naughtiest thing, though, is over the past few days, it's just been crazy with work, and my eating habits have really fallen off. And I'm super aware of it, but I'm just kind of watching it happen. It's like a train wreck. I just have been skipping meals. I had a bit of ice cream last night before bed, knowing in my mind of like, this is not good for me right now to be having this. And my sugars have been all off because I've just not been eating consistently with just the busyness that's been going on. But, try not to beat myself up about it. A new week is about to start, and I'll just, pick it up from there.
Exactly. If you weren't a nurse practitioner, what would you do?
Oh, definitely either a travel planner or a wedding planner. I've loved doing both so much. I've asked all of my friends, if you need help planning your wedding or any travel honeymoon, I'm your girl. I thoroughly enjoy the whole process of researching and booking things. So that would be, I always say that to my friends.
Awesome. Mental note. Your favorite book on any topic or fiction except your area of expertise?
The Alchemist.
Yes, so good.
Love that book.
If you could cure one ailment, disease, or sickness, what would it be?
I I would probably say mental health, mental disease, because I think that if we were able to cure that, our physical body would actually be able to heal. And, I'm sure you could probably get all different answers with that. I think like cancer too, but I feel like if we helped solve the mental disease portion, then maybe we can prevent all kinds of physical ailments. So that would be my.
Yes. I love that one. If you were a superhero, what would be your superpower?
Maybe this is going to sound so silly, but I always have, well, as a kid, I used to have dreams that I was actually flying, like physically flying. So I would say like being able to actually fly to places.
Yes. A lot of people say flying. Yeah. What's your biggest pet peeve?
uh, Probably when people say they're going to do something but don't follow through with it. That like irks me.
Yes.
Like just don't say it then. It's okay. Like if you can't commit, don't say it.
Absolutely. I think of that as like integrity.
Yeah, it just gets me. It just I don't know. I
Yes.
grew up with just when I say it, I make sure that I'm going to follow through.
Absolutely. Finally, in your opinion, what's the next frontier in wellness?
I would say just really looking at how much our mental health affects everything and really trying to link those two, mental and physical health, much more together. I mean, I feel like it's starting and I'm seeing that like in companies and organizations, they're slowly starting to make that more of a priority for their employees. Maybe with all this COVID stuff and everybody staying home, just maybe looking at seeing that productivity is going up. I just think that it's been so pushed to the side for so long. And I think if we can really connect those two together, we can really uplift and improve everyone's health. So, yeah.
Absolutely. Well, thank you for being here. Tell everybody how to connect with you and the Ladies Guide.
Thank you so much, Jen, for having me. So you can find me on Instagram. I'm at _ the Ladies Guide. It's LADYS Guide. And on YouTube, the Ladies Guide as well. I'm always trying to interact with my people out there, any woman that wants to connect with me. I love hearing from you. And I also offer one-on-one wellness sessions, really diving in further if you'd like more information and how to really improve your life if you want to balance your hormones, improve fertility. So that's where you can find me.
Excellent. Deanna, thank you again for being here. Super appreciate your time and generosity to share all of your expertise. So
thank you so much. This is awesome.
Yeah. Do you have another minute to hang out for our nutrition nugget?
Sure. Yeah.
Perfect. This week's nutrition nugget is all about breakfast. Now, we've heard the old saying, breakfast is the most important meal of the day, right? And then other people swear by not eating until midday or even later. And then other people will say, well, I just don't feel like eating in the morning. So what are we supposed to do? So interestingly enough, a couple weeks ago, we did the nutrition nugget talking about fasting. So reference that for why I'm not a big fan of waiting till midday or later to eat. And really to get your metabolism burning and to cue your body that it's daytime, right? We've talked about hormones, right? To get your body rocking and rolling and performing, we have to give ourselves fuel.
Yes.
Right?
Mm-hmm.
For me personally, over the years, I've noticed that when I don't eat breakfast, food choices the rest of the day are different. So sometimes it's staying, quote unquote, in control because I'm hungry. And yet other times it's like we give ourselves permission to eat whatever because otherwise, it's like we just talk ourselves into it. Well, we didn't eat for a chunk of the day. So we give ourselves permission. So I pose the question to you, really, honestly, what do you notice about days when you don't eat breakfast compared to days you do? And a lot of this just sort of starts with that personal inventory. Of course, though, I'm always going to give you a guideline. So your guideline is to shoot for getting something in your system within an hour of waking up. This starts the engine. If we wait too much longer than that, our body flips into survival mode. The starvation response of storing fat kicks in, which most of us want the opposite of that, right? So fuel within an hour of waking up. But then what do we want that fuel to be? So we've seen commercials for years showing a quote unquote balanced breakfast of cereal, toast, and juice. Or we see the bowl of oatmeal with toast and juice. So if you tune in often to us here at Salad with a Side of Fries, you know these options are formulas for fat storage, packed with high glycemic carbohydrates and sugar. Which means instead, we want to fuel with protein and fiber. So of course, I'm going to say it again. I say it all the time. You guys know it. Protein and fiber at every meal makes removing fat no big deal. So what does that look like at breakfast? It could be a veggie omelet. I also give a recipe for these little like egg bites. You use like a muffin tin to make them, and you can throw a bunch of veggies in there and make them in advance and just heat them up to have in the morning. If you're a dairy person, you could choose a low-fat plain Greek yogurt with some almonds or walnuts and berries. And if you really want, you could sprinkle a little low-carb cereal or granola on top, remembering treat that more like a condiment rather than, your primary source of nutrition. And my absolute favorite thing to eat in the morning for breakfast is a breakfast salad. And I know all of you guys just rolled your eyes, but hear me out. So use your favorite greens, whatever you want, add a few other veggies, throw it in a bowl, right? Remember, we want to eat the rainbow. And then I'll cook a couple eggs and put them on top. If you keep the yolk a little runny, it almost makes a salad dressing. And, sometimes I'll add a little balsamic vinegar too. And when I'm looking for something a little more decadent, maybe I'll splurge on a little turkey sausage, right? Like I know it's processed, but every now and then it just hits the spot. Or maybe a touch of a little feta cheese, right? So here's the thing. You can actually eat whatever you like from the protein and fiber categories at any time of day. The only thing that makes it breakfast is that we're eating it in the morning. So do what you got to do. Choose what you want to eat. Pay attention to how you feel on the days you eat breakfast and the days you don't. For those of you who are not ones to eat in the morning, I encourage you to just get something in your system within an hour of waking up. It might be a handful of baby carrots, an apple, and a few almonds, but something to get your metabolism going, right? And like I said, I'm going to say it one more time. What do you notice about the days you have protein and fiber in the morning compared to days you eat that cereal or a bagel, right? And then be honest, right? I'd be willing to bet money that you feel different depending on what you eat for breakfast.
Absolutely.
Right? So again, key takeaway, focus on proper fuel of protein and fiber. Your fiber is coming from veggies or fruit, and notice how you feel throughout the day when your breakfast is on track. Good?
That is spot on. That was me this week for sure.
Awesome. Well, Deanna, thank you again for being here and joining me from afar.
Yes, thank you so much. This is awesome.
Excellent. And as always, guys, I'm your host, Jenn Trepeck. Connect with me on Instagram at Jenn Trepeck, JENNTREPECK. Our Facebook page is at the same handle, and we want to hear from you. So submit your questions, ideas, your takeaway videos. This is all the best way, social media is the best way to reach out and answer any questions, inquire about working with me, all the things. Of course, if you're not already a member, join our membership program by going to glow.fm/salad with a side of fries to get this week's cauliflower Spanish rice and shrimp stir fry recipes, plus also your free one-on-one session with me. Everybody remember, it all comes down to living a healthful lifestyle. We're always here to support you, and we'll be here next week. See you then. Well, friends, that's it for today's episode of Salad with a Side of Fries. Congratulations for making yourself and your health a priority. Thanks so much for joining us. Be sure to click subscribe or follow on your favorite podcast platform. Share us with a friend, and we'll be back next week. Always remember, you deserve it, and you are worth it. Happy healthy.